Hi, this is Krista Frable, and this is my presentation on solving problems in the workplace through interventions. Patient safety is a priority across the country. The intervention project I chose focuses primarily on improving patient safety. What is the problem? Inaccurate documentation of patient weights in the electronic medical record, which have led to sentinel patient safety events. All patients who present to the hospital for treatment require a weight documented in the electronic medical record. Therefore, all patients are at risk for inaccurately documented weights. Medications are dosed based on a patient's weight. There have been medication errors as a result of inaccurately documented patient weights in the electronic medical record, which have caused or come close to causing patient harm. Evidence shows that accurate patient weight is a key measure for safe medication administration. This is especially important in pediatric patients where a small weight change can make a big difference in the dosing of medication. Two interventions were identified that may help in the prevention of inaccurately documented patient weights. The first intervention is the standardization of all scales in kilograms within the organization. Evidence shows that one way to prevent a patient's weight from being recorded in pounds instead of kilograms is to have scales only read in kilograms. A joint policy recommendation by the American Academy of Pediatrics, the American College of Emergency Physicians, and the Emergency Nurse Association states that every emergency department in the United States that cares for pediatric patients must have a scale that displays in kilograms only, not pounds, for infants and children. The second intervention identified is the building of a technical warning or alert in the electronic medical record to identify the possible weight documentation error and alert the nurse. This alert will fire or send a warning to the nurse that something is wrong with the documented weight. Evidence shows that relatively simple tools can be put in place to identify weight documentation errors. The parameters that were established for this intervention include a weight change of 10% or more in the last 30 days, or a BMI of 97%, greater than 97%, and less than 3%. 3 goals and objectives have been identified. These include accurate weight documentation, no sentinel patient safety events, and improved patient safety. Resources are necessary to implement these interventions. First, we need financial resources. Money was necessary to purchase scales for the organization. The total cost was approximately $500,000. Another financial resource is the cost of non-productive time for direct care nurses, the key stakeholders, to attend the Nursing Clinical Quality and Informatics Council. These nurses provide frontline information to help in solving problems. We also need human resources. We need direct care nurses to identify workflow processes, gaps, and barriers. Nursing councils for collaboration, as previously mentioned, information technology to perform the technical computer skills to implement changes, in this case, the alert, individuals needed to test and build and implement technical changes, and finally, clinical end users to perform a trial of the alert once it is in place. We also need structural resources. This includes the technical build and design of the alert in the electronic medical record. All of these resources were identified early on in the beginning of the project. However, the magnitude to which each would be needed was not known. There were several barriers and challenges along the way during the implementation of this intervention. The Nursing Quality and Informatics Council only meets monthly. Each part of the process requires discussion and input from the council. Therefore, monthly meetings delay the process. Delays by information technology. IT usually has multiple jobs at once, and this has not been a priority. Complexities of the technical build. This goes along with the IT delays. This particular alert has posed many challenges for our IT partners. Approval by patient safety. Once IT builds the alert and it goes through the many steps with the council, it then has to be approved by the patient safety department. The change process is slow. Each step in the approval process has gaps in time as everyone is busy, juggling multiple schedules and projects. Meetings are scheduled around everyone's busy schedule, and therefore there are huge gaps in time from one meeting to the next. There are several ways of evaluating the outcomes of the interventions. Standardized scales measuring in only kilograms throughout the organization. Operational use of the technical warning or alert, fires when appropriate. No sentinel events as a result of the inaccurate documentation of a patient's weight. And no patient harm or near harm as a result of the inaccurate documentation of patient's weight. Future state, we will have scales displaying in kilograms only, and there will be a technical warning or alert. Follow-up and final implementation will be done by the Director of Nursing Informatics. This technical warning or alert cannot be forgotten, as it was going to be a permanent part of the electronic medical record. The informatics nurse integrates nursing science with multiple information and analytic sciences to identify, define, manage, and communicate data, information, knowledge, and wisdom in nursing practice. The informatics nurse leader is an integral part in addressing this problem. The informatics nurse leader understands nursing workflow, identifies gaps and barriers, works with the direct care nurses and information technology, and is a liaison between the two cultures. The informatics nurse leader translates the clinical needs, leads change, and is a change agent. In order to evaluate this intervention, the desired outcomes are the standardized scales in kilograms. This is complete. The technical alert is near completion. This leads to accurate weight documentation, no sentinel patient safety events, and improved patient safety. The theoretical framework used for this project was the change theory by Kurt Lewin. The first phase is unfreezing, where there is planning, preliminary diagnosis, data gathering, feedback of results, and action planning. The need for change is discovered by the sentinel patient safety event, and a plan is identified. The second phase is the movement or action plan. This is learning processes, action planning, action steps. Action occurs through the purchasing and using standardized scales in kilograms only, and the implementation and use of a technical alert. The third phase is refreezing. Changes in behavior, data gathering, and measurement. In refreezing, the nurse leader will help to establish the change into status quo. The same framework was used in the identification of the problem as in the implementation, as these were the steps required for this intervention to occur. Another key part of this intervention is illustrated in this diagram. We identified the initial plan or idea, did some fact-finding with the Quality and Informatics Council, did some planning, took our first action, went back to the council and evaluated what we had done, amended the plan, and so on. This was done for 3 months and is still being done. It is a long change process, but is getting closer to completion with each step. In conclusion, one sentinel event caused by the inaccurate documentation of a patient's weight is one event too many. The implementation of standardized scales and a technical alert will help to solve the problem. Lessons learned. Changes to the electronic medical record are slow. Information technology dependency has challenges. One sentinel event is one too many. Action is necessary to prevent patient harm and improve patient safety. To err is human. And the electronic medical record is only as good as the data entered. These two interventions will not solve the problem. The goal is that they help to minimize any future problems and help with the human error that occurs. They are tools used to help prevent errors. Here's a list of my references. I hope you've enjoyed my presentation. Thank you.